Hi, welcome to another educational video on the subject of depression and antidepressants. By the end of this video, I hope you'll have a clearer understanding of depression and where to generally place antidepressants in the management of depression. I'll go through the mechanism of action of antidepressants, some data on the efficacy of antidepressants, and an overview of what a depression management hub looks like. There is a fair bit of confusion about the role of antidepressants, and sometimes when a patient is depressed, not knowing what care support is available can be frustrating for both the clinician and patient alike. There are countless different ways you can improve mental health and tackle depression, which we hope to cover in this video. But first, let's talk about antidepressants. Generally speaking, antidepressants were designed to target monoamine neurotransmitter function that increases serotonin and noradrenaline in the brain. At least initially, however, this may not be a sustained effect. Antidepressants can treat some symptoms of depression but do not address the root causes of depression, which may be psychological or physical. It could also mitigate automatic negative thoughts, similar to what cognitive behavioral therapy does. The effects of antidepressants are less clear in children and adolescents. It may improve symptoms after about 12 weeks of use. It may also increase the risk of suicide, so young adults, less than 25 years, and children need closer monitoring. These medications cause side effects like agitation, loss of appetite, sleep problems, sexual dysfunction, dizziness, blurred vision, dry mouth, and low sodium, especially in the elderly, to name a few. In terms of the efficacy of antidepressants, clinicians usually use a statistical term called number needed to treat, NNT, to decide how efficacious a medication might be. A rule of thumb: the smaller the number, the more effective the medication is at producing the desired outcome. For example, NNT of 1 for drug X means that if one person received the drug X, they get the benefit of taking that drug, whereas NNT of 50 for drug Y means 50 people need to take drug Y for one person to get the benefit of taking drug Y. This means the remaining 49 people were needlessly exposed to the drug and may have experienced side effects without getting any benefit. So generally speaking, you would prefer to be receiving drugs that have an NNT closer to 1 than farther away from 1. This may be an oversimplification, but I hope you get the point. What is the NNT for antidepressants? According to some sources, which I'll list in the description below, antidepressants, SSRI included here, range from 7 to 19 after 8 weeks of use, with an outcome of 50% reduction of depression symptoms from baseline. For other outcomes like preventing reoccurrence or relapse in chronic depression, it's around 3 or 4. As a clinician, you may find antidepressants work better for patients with chronic comorbid psychological conditions rather than mild to moderate depression that has only been reported for less than 6 months. But are you excited by these numbers? When you decide to take antidepressants, most people use it for about 6 to 7 months before the benefit is established. Others may persevere for 1 to 2 years after experiencing the desired outcome. This is usually recommended if you have chronic major depression to mitigate relapse or reoccurrence. It is best practice to let patients decide if they want to go on antidepressants. Bear in mind, the higher the dose, the more risk of side effects and little or no gain in terms of benefit. Now let's look at a systemic approach to managing depression. This is what I call a depression management hub. The first line of defense is self-help. This can take various shapes. You decide what works for you. Think about which life event or psychological cause may have triggered depression, although in a few cases, there may be no apparent reason. Here are some examples: homelessness, unemployment, chronic physical illness, chronic pain, conflict, wars, addiction, burnout at work or home, domestic violence, sexual health, bereavement, and other psychological conditions like generalized anxiety disorder, OCD, PTSD, panic attack, etc. In terms of the support network and therapies, your GP can help to diagnose depression, signpost you to resources, refer you to specialists, and when prescribing is needed, to monitor response and manage the side effects of medications. There are also other players like churches, charities, individuals, chronic disease patient groups, and a host of IT online mediated support tools available. Therapies like CBT, talk therapy, befriending services, and group therapies are available. CBT is a form of therapy where a trained professional helps you connect your thoughts to your mood and supports you to develop coping mechanisms. I'll tell you more about these symptoms in a moment. Clinical psychologists, mental health nurses, counselors, psychological therapists, psychiatrists, and social workers are part of the workforce to support mental health services. Your GP can connect you to the right team. Most local commissioning groups receive funding to support the initiative called Adult Improving Access to Psychological Therapies, which began in 2008 in the UK. These services can cater to less complex mental health diagnoses, including depression. You can find more information about available IAPT services in your local online formulary guidance under mental health. At this point, you may be asking, how do I know if I need an intervention for depression? Here are some important considerations. Is depression increasing the likelihood of drug and alcohol addiction? Do I feel like considering self-harm or suicide? Am I having difficulty challenging my negative thoughts? Am I struggling with my ability to cope with or adapt to a chronic illness? Depression is more than just a bad day. It's a persistent feeling of low mood that impacts your quality of life. The impact could be mild, moderate, or severe. You can use the PHQ-9 questionnaire to assess the severity of depression and monitor recovery. Symptoms of depression include the following but are not limited to disturbed sleep, change in appetite, fatigue or loss of energy, agitation or slowing down, poor concentration, persistent feeling of worthlessness or guilt, suicidal ideas or plans, sexual dysfunction or low sex drive, over-worrying or overthinking, various aches and pains, persistent feeling of hopelessness, sadness, helplessness or apathy, low self-esteem or loss of interest in things you usually found pleasurable. I hope this gives you a sense of what depression is and where antidepressants can be used in the management of depression. Till we meet again, thanks for watching.